Joining us now is Dr. Amos Adalja, who's an infectious disease specialist. He's a senior scholar at the Johns Hopkins Center for Health Security. Welcome, Dr. Adalja. I wanted to, play Kennedy in his own words, talking about some of these issues that he's been associated with over the years. Many in your area of expertise, public health, have raised questions. How about yourself? How do you feel about this?
I think this is an irresponsible pick to be HHS secretary. RFK Jr. can only be seen as a destroyer of health, not somebody who's going to promote health. If with the amount of data that we have on the safety, the efficacy of vaccines, how vaccines have added decades to everyone's lifespan, saved hundreds of millions of lives, if that's not enough for him, if he can evade that and be someone who questions vaccines, who smears vaccines, who lies about vaccines, that tells you that he's really a nihilist, that he's trying to go after one of humankind's greatest achievements. And to me, that's not somebody that you want to be in power, to be able to wield the force of government. And whatever he may say about other things, his cognitive approach to vaccines colors everything else. This is how this man thinks or doesn't think.
So when he makes an argument about fighting obesity or getting chemicals out of our foods or taking on the big chemical companies or big pharma, you say that's overridden by the vaccine skepticism, that you can't take those good points. Both things can't be true if you're the health secretary.
Right. You can't compartmentalize those two things. The same science that proves the efficacy and safety of vaccines is the same science that we're going to use to tackle obesity, to tackle chronic conditions. So you can't really pick and choose when you're going to follow the scientific method and when you're going to say it doesn't apply. You can't do that. And I think what you want is somebody that embraces science, embraces logic, and is able to be persuaded based on facts and reasoning. And he's basically held this anti-vaccine belief almost like or just like a religious person holds on to kind of an absurd idea. And you cannot penetrate it with rationality because he's not open to rationality. This is a fixed idea in his mind. And I don't think that someone who is susceptible to that style of non-thinking is someone that you want making decisions about any kind of anything regarding health.
You heard him in that clip say he's not anti-vax, that he just wants more safety around vaccines. That doesn't represent any kind of an evolution on the topic in your mind versus his past statements?
No, because he also wants to erect a statue to Andrew Wakefield, the man who falsely claimed vaccines are linked to autism. We've seen him ask for people to sue vaccine manufacturers, which is basically effectively going to push them out of the industry if they're faced with an onslaught of lawsuits based on his faulty rationale. So no, I don't think this is a softening. You can't say that you are not anti-vax and then spread lies. And actually, there are statements where he's tried to advise parents of new children not to vaccinate their child, where he said that vaccine autism link, he's convinced of it. And he said it even after it's been debunked and disproved. So no, I don't think that this is any kind of softening. I think this is just kind of a rhetorical flourish trying to make it look that way. But no, I think deep down, he is a true believer in this anti-scientific, anti-vaccine dark ages worldview that he has.
Final point. And again, I understand your position that you can't separate Kennedy from, some of his other positions on other issues from the vaccine issue, in your mind. What about this larger conversation in the country that we should be having between the relationship in public health with large companies, whether it be drug companies, chemical companies, and our health as a country? Is that a conversation that we don't have enough, that there's more to talk about in your view, or?
I don't like the way that it's framed, because when you think about the biotechnology, pharmaceutical companies, they are sort of what saved the world. When you look at Moderna, Pfizer, BioNTech, and the COVID vaccines, if it weren't for their work, we would not have a vaccine. Same with Merck and other childhood vaccinations. So much of the innovation, much of the scaling, the ability to get vaccines into arms, to turn something that might be a scientific experiment in a university lab into a product, that's the pharmaceutical companies. And I do think they save lives, and they are smeared all the time for this. And what we would not be in the same world if there weren't pharmaceutical companies. So in my mind, I don't like the way that people go after the pharmaceutical companies in this manner, because I think it really ignores or evades the fact that they're the ones that turn vaccines into vaccinations, develop products that are safe and effective, that spend over $1 billion for each vaccine to come to market. So in my mind, we owe pharmaceutical companies a thank you, rather than the kind of rhetoric that RFK Jr. hurls at them.
Thanks so much for watching. Just go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.